So the research that I'm doing is looking at direct care workers, specifically working in nursing homes. What we're trying to look at is why these direct care workers stay in the work that they do. A lot of the direct care work is difficult work. It deals with interpersonal relationships with patients, with other staff members, with patients' families. The pay is usually pretty low, and the stress level is kind of high. And so what we're trying to do is just to look at these factors that influence staying versus leaving, and trying to sort of tell organizations what can you do to make the workforce better, make work better for the workforce, and to eventually improve the quality of care for your patients. It really means a lot to me to have people like Jules Rosen, Vikas Mittal, Carrie Liana to work with sort of in a collaborative way. A lot of the work that's done in organizational behavior looks at managers, looks at knowledge workers, looks at people who have a lot of status or a lot of power in the organization to get things done. What's interesting though is that a lot of the work in organizational behavior sort of overlooked some of these frontline workers. And so the work that I get to do, I actually get to look at these frontline workers, look at a population that may have been overlooked otherwise. What's also interesting about this cross-collaboration though is that if I were working with Jules specifically, the problems that he's looking at are specific to nursing homes, and they're sort of looking at how can we improve this workforce. The issues that Carrie's looking at are sort of how can we improve the meaning of this work, how can we improve the work that they're doing. And so what's nice is that bringing those two together, it's easier for me to find sort of that middle ground that I find interesting. It really meant a lot to me to win the Aspen Institute Dissertation Proposal Award, and I was able to go to New York to receive the award, to meet the other people who are sort of involved in the Aspen Institute. And what I found was there's actually a whole community of people who are interested in these issues. So winning this award meant a lot to me just in terms of reinforcing my research, reinforcing the ideas that I had, but it was also really great to me to see that there is this community that supports the research that I'm doing. It was really about getting together with a group who was passionate about solving the issues of frontline workers. It wasn't just about the research, it was about the desire to help people and the desire to bring about some better solution to the issues facing frontline workers. But what it seems is that maybe if we build up this full-time, stable workforce, then eventually the quality of care for the patients is going to become more consistent. The organization will have to deal less with turnover, with hiring new staff continually, and the consistency of care, even between coworkers, their ability to work together, to share information, to share ideas, will be stronger. So the research that we found, the main findings, are that maybe this full-time workforce is not as likely to turn over as we thought. And they might actually be much more stable and a much better investment for the organization, even if they cost a little bit more in the short term.